All right, it's 12 o'clock on my clock, so I think we'll go ahead and get started here. So I want to welcome everybody to our Raising Your Dairy Best Heifer webinar series. This is sponsored by Iowa State University Extension and Outreach. My name is Jennifer Bentley. I work as a dairy field specialist in Northeast Iowa, and I've offered this season two of this Raising Your Dairy Best Heifer webinar. We had a lot of good topics last season, and I wanted to bring it back and incorporate more of these topics into our educational programming here. So we are in the midst of these topics here. So Ryan, if you wouldn't mind advancing that slide there. Today we're going to be talking about colostrum delivery strategies, but I do just want to remind our participants that we do have a couple more coming up here through the beginning of December. So um, next week, we'll have Dr. Gail Carpenter talking about practical tips for managing heifer body condition. And then we'll follow up with Dr. Howard Tyler talking about fresh cow success starts with the heifer and calving pen readiness. And then on November 19th, Dr. Larry Tranel will be talking about pasture raised potential grazing dairy heifers for performance and profit. And then we'll round out our series with Dr. Martin talking about heifer mastitis on December 3rd. So hope you can join us for those. If you can't, these are recorded and will be archived on our YouTube channel, so you can go back and view them. I'll let you know within the week when they become available on our YouTube channel that you can go back and do that. So if you have questions throughout the webinar here today, please go ahead and put those into the chat box, and we'll either address them during the presentation if they fit into the presentation, or we'll address them at the end. We'll have time to do a Q&A here at the end as well. So I do want to introduce our presenters here today. We have Dr. Donald Sockett and Dr. Ryan Breuer from University of Wisconsin-Madison. So Dr. Sockett is a diagnostic case and outreach coordinator at the Wisconsin Vet Diagnostic Laboratory, University of Wisconsin-Madison. He's recognized internationally for his work on infectious diseases of livestock, particularly dairy cattle, and he's responsible for diagnostic cases that are submitted to the lab by practicing veterinarians and livestock producers. He also conducts outreach education. He's a native of Southern Ontario, Canada, and holds degrees from University of Guelph, Colorado State University, and University of Wisconsin-Madison. So he came to the diagnostic lab in 1995 after spending 4 years in Wisconsin Department of Ag Division of Animal Health. So we want to welcome Dr. Sockett as well as Dr. Breuer. He's on our presentation here as well, a former colleague of mine, so I'm happy to have him on here as well. So Dr. Ryan Breuer holds a dual appointment as a diagnostic case and outreach coordinator at the Wisconsin Vet Diagnostic Lab, as well as a clinical assistant professor of large animal internal medicine at the University of Wisconsin-Madison School of Veterinary Medicine. He's from a diversified rural farming community in southeast Wisconsin with a background in lots of agricultural experiences. He completed his DVM degree in 2012 from UW, and he's practiced large animal medicine and general practice in Wisconsin, and prior to completing residency training program at Iowa State University. Breuer focuses in consulting with veterinarians as well as teaching vet students, and his area of interest includes large animal internal medicine, concepts of AVMA approved humane euthanasia for large animal species, herd health, and calf welfare. So I want to extend a big welcome to both of you. I know you both are busy, so I appreciate you both being on here today giving this presentation on colostrum delivery strategies. So with that, I'll turn it over to you.
It's a pleasure to be here. I'm speaking for myself, and Dr. Sockett will join here too. He's sitting right next to me, but we're glad that we could present here today towards all the people that are joining, as well as those that are going to be viewing this later than just today. As Jen said, Dr. Sockett and I hold appointments here at the Diagnostic Lab, and we see a fair bit of calf issues come to the diagnostic lab here in Wisconsin. As a dairy state, we promote ourselves here in Wisconsin for the very best dairy diagnostics as well. And with that, we see issues that are going on currently with dairy calves and dairy cows and what have you. So we're quite fortunate to be able to see and evaluate disease diagnostics in dairy medicine, not only here in Wisconsin, but across the country, because we get those samples in nationwide. Our focus today is going to look at strategic colostrum feeding and what we've been doing, what we've been finding, and then looking at the different new technologies or basically new research that have been coming out and kind of telling us what improvements need to be made within dairy calf health and specifically focusing on strategic colostrum feeding. We like to show this image. Dr. Sockett likes to start off a lot of his conferences and meetings with this image because I think a lot of times we forget that calves are babies, just like the baby that we see. So they're very sensitive to a lot of management styles and things that we potentially do when we work with them. So we don't want folks to forget that these are infants and they're very sensitive to the environment, management styles, and procedures that we may conduct with them. So without further ado, I'll get started with this webinar and talk about some recent publications that we've had. These are two inciting publications that Dr. Sockett and I had when we were realizing that we were seeing more calves coming through the diagnostic lab with issues centered around or early on in their neonatal period, suggesting that there might be issues with colostrum management and feeding. The first one here that you'll see is severe colic in a newborn dairy calf caused by a large colostrum curd. I'll touch on that a little bit later in this webinar, but and then have some images that go along with this publication. And then also the publication that came before this case report was investigation of the Brooks refractometer and how it estimates bovine colostrum IgG concentration. And we'll look at a few charts that come from that publication that we utilize for cut points or break points here at the lab when evaluating colostrum quality and value of that colostrum. So I'd like to kind of start off to say that we all know that first milking colostrum is essential for great newborn calf health and well-being. But I think sometimes we, as dairy producers, veterinarians, and those focused in the dairy industry, can kind of forget or maybe be misled in that in our commercial dairies, our cows actually can produce very high quality colostrum. A lot of my initial publications and work in colostrum evaluation started at ISU during my residency when we worked on beef cows in the cow-calf watch there at the vet school. And we noticed that we were getting great transfer of passive immunity in these beef calves, but these beef calves were nursing more frequently, small volumes of colostrum. And as we might know, beef cows are great at producing high quality as far as mass of IgG in their colostrum, but the volume is very low. Where we have a little bit of an issue with dairy cattle where they can produce a lot higher volumes of colostrum. And our worry is that sometimes that volume interferes with the mass of IgG being produced. Where actually we're kind of finding that these dairy cows can produce really good quality. So I'm not sure if you can see my cursor or not, but in this New York dairy, this was a publication published not too long ago, I believe. Let's see, I have to move the screen here. In 2024, where this 5,000 cow dairy herd had cows producing colostrum, 38% or close to 40% of them were producing IgG with concentration or colostrum with IgG concentrations of greater than 100 grams per liter, which is great. It's excellent. But it makes us wonder, are we potentially providing too much IgG in a way that colostrum is not readily available on some good, high quality, excellent colostrum is not readily available to calves. So is there a way that we can conserve some of this really high quality colostrum by feeding maybe a little less? Because our break points, and we'll get to those from our publication, have actually increased, where 50 grams per liter uh, can actually be bumped up to that 70 grams per liter or greater for good or high quality colostrum when we look at it from a mass standpoint. So that's what I kind of wanted to bring across here, that our dairy cows are doing actually a really good job of hitting that 50 grams of IgG per liter, but actually they're hitting it at higher rates as well. We're only 10% in the herd are less than that. So just wanted to kind of give a general perspective of how colostrum is absorbed and how the gut of the new calf or neonatal calf receives that colostrum. So in this image here, this is actually the lumen, or where colostrum or feed material is taken or seen by the gut. And then this is the layer or the mucosal layer of the GI tract. And actually the receiving of IgG is processed through a system called pinocytosis, where actually the gut mucus layer is pinching off these IgG or the good substances in colostrum and then actually bringing it into the body or into the tissue as a vesicle where it can be absorbed into the bloodstream. And then those antibodies are utilized by the calf. Now, it's important to understand that we understand that there is a decline of efficacy of absorption. And here it says at 3 hours after birth down to 22% efficacy. But these are animals that are black and white. Now that's a Holstein joke, but not every animal is black and white. There's gray regions. So this decline to 22% of efficacy at 3 hours is not black and white. There's certainly some ranges there.
Where
And
is the colostrum hemoglobin absorbed?
the great question. The immunoglobulin is absorbed in the small intestine, so past the forestomach, or what we would say is the rudimentary stomach of the calf, which is the abomasum, because the rumen is not developed. So these calves are actually termed monogastric, meaning they're kind of a single stomached animal at birth, and then slowly develop into a functional ruminant much later in their calf life. So a few weeks have to go by where they develop that rumen. So again, down here at the bottom of the screen, we know that diminished absorptive ability is decreased substantially in that 12 to 24-hour range. And then it's due to that shedding of the specialized enterocytes, those cells that can pinch off those immunoglobulins and absorb them at a much more efficient level than when the calf gets older. But we also do know, we'll go back to that colostrum or even transition milk from colostrum to that whole milk that the cow is producing for people is beneficial in a transition form because there is good components beyond just IgG that is helpful in the luminary aspect of that feeding. This, I just want to give you a kind of a general sense. This is not a hard and fast line that says the absorptive ability of the gut is gone or at 50% at 12 hours. Because again, this is just kind of a conceptual graph to say there is a decline over time with calves to show that their ability to absorb that IgG does reduce substantially within the first 24 to 42 hours, 46 hours of life. But it is important that we feed these calves early on to capture that efficiency in colostrum absorption. So I'd like to kind of go back to this 2020 publication by Dr. Lombard that shows there kind of was a consensus on recommendations for kind of categorizing good transfer of passive immunity, and categorizing it as excellent, good, fair, and poor. And I know there's a lot of different veterinarians on this publication that went into discussing uh, these different cutoffs. So they both looked at serum IgG levels, and they really haven't changed very much from a standpoint of excellent, good, fair, and poor. And then the total protein, which is a gram per deciliter evaluation. Again, looking at that total protein in excellent, good, fair, and poor relationship as well. And then they looked at Brix percentage for that serum. And then a consensus was that excellent calves there should be 40% or greater of that population of calves having excellent transfer of passive immunity and less than 10% of the population of calves um, for transfer passive immunity. So those are kind of benchmarks in what calves should be receiving. We take this information and utilize it, and then we have discussions with veterinarians on the telephone all the time. That's Dr. Sockett and my majority of our appointment here at the diagnostic lab. We're consultants to a lot of these different veterinarians calling into the lab. And this particular case that I'm showing here is a case that Dr. Sockett and I have chatted with Dr. Johnny Ambrosi at the Wanakee Veterinary Clinic. They do a lot of lung ultrasound at this clinic. It's a very progressive clinic and sees a lot of great Wisconsin dairies that do a lot of best practice. And this particular dairy is a dairy that we would consider a best practice when it's looking at ventilation, calf health, barn cleanliness, treatment and therapies, as well as colostrum delivery. So in this first column, again, we share that excellent, good, fair, and poor category, and then again, keeping the total proteins as their benchmarks. But when looking at 527 calves, this is information that Dr. Ambrosi has shared with us and has allowed us to share outward as well. With these 527 calves, of them, 44% or about 45% hit that excellent category when looking at transfer of passive immunity. When looking at calves that were ultrasounded in these categories, so that's this number here, the 236, just looking at the excellent category, of that 236 in the excellent transfer of passive immunity category, 88 of them had an ultrasound score of greater than 3. So we know that ultrasound scores at around 1 are normal. And then as we increase up to 5, then that's more poor or poor prognosis. So even calves with an excellent transfer of passive immunity, 36% of them were still diagnosed with BRD and had lung scores of greater than 3 on that scale. Now, as we go down, the calves in the poor category, it's a good thing here. We're only seeing 21 of those 527 calves were scored in the poor category of transfer of passive immunity, and 16 of them were greater than that lung score of 3. But the percentage, again, of calves with BRD is increasingly high. And then we looked at that different odds ratios, looking at excellent versus good category, and then excellent versus fair, and then good versus fair. There was no real statistical significance between the excellent versus fair calves in this herd, but there was for respiratory disease significant statistical significance here when looking the excellent versus good quality of transfer of passive immunity. So this transfer of passive immunity is helping these calves through their respiratory event. And we even see that in the good versus the fair. There's still statistical significance there. And we know this information also exists out in literature when dealing with scours. So the better the category, so excellent versus good, with scour calves, that their disease incidence or odds ratio is much less when they have excellent and good quality or categorized as transfer of passive immunity.
I like to say something here.
Go ahead.
The reason this is here is to show you that the only calves that had a statistical reduction in the incidence of pneumonia when you comparing excellent, good, and fair were those in the excellent category. So, so only the excellent category had a reduction in pneumonia when compared to the good and the fair. That's really interesting. But the other thing is, this is a dairy operation that is extremely well managed and is doing what we call best practices for the typical things that what Dr. Breuer talked about. But even when you're doing everything right, 37.3% of the calves had ultrasound evidence of subclinical pneumonia before weaning. So that's telling us that there's a lot of work still needs to be done is find out what's going wrong here. That basically a third of our calves are getting subclinical pneumonia before weaning, even when you do everything right. So so there's a good side and a bad side to this. The respiratory disease incidence declined, but we still have an unacceptably high amount of pre-weaning pneumonia in our calves.
Thanks for that inclusion. So this chart goes back to our study in 2003 when we used some cows from a dairy here in Wisconsin. I think there was 182 cows in that study. Four herds, sorry, there was four herds there where we collected colostrum, and it was stratified different evaluation of classifying these animals colostrum and looking at transition milk, and then how we use that same scheme of excellent, good, fair, and poor quality colostrum. And this is where we found in those stratified groups of cows and their colostrum where they were producing excellent quality colostrum at greater than 100 grams per deciliter of IgG in that colostrum. So we feel and I'll show the next slide will show the Brix readings for these calves, or the cow's colostrum, that we can expect higher quality colostrum coming from these cows, and then feed that higher quality colostrum to the calves initially, and potentially use that fair poor transition milk in subsequent feedings for those calves.
An important take-home message, go back please,
Sure.
of this is the old recommendations treated all the colostrum the same, was 50 grams per liter or higher of IgG. Okay. But if the average or the mean is 75 to 95 grams per liter, it's obvious that that's not good quality colostrum. That's why we call it fair quality. And the other thing is, why would you build a whole program around fair colostrum? It doesn't make any sense because since colostrum is liquid gold, we got to strategically use it in the best way possible for the benefit of the operation. These the 50 grams per liter are just too crude to take us to the next level where we want to go.
All right. And this is from that same study, just illustrating that when colostrum was at the 25 grams per liter, it had a Brix reading of 18.7, and we proposed a 19 percentage to include or capture a higher percentage of colostrum IgG. And then all the way up to that 100 grams per liter, we were seeing the Brix readings on average with a correlation coefficient of 95% at 30.1. So we rounded that to a 30% Brix reading for proposal, and to make it easier from a whole number standpoint. So I'll have two more slides here, and then I'll let Dr. Sockett kind of talk about some future studies and other things that we're seeing here at the diagnostic lab. But this actually is from our publication that I showed on our first slide. It was the case report of a Holstein heifer calf that received what we call best practices for colostrum delivery. And this calf received 4 liters of good quality colostrum. I can't remember the, sorry about that. It is in the publication, but it shows that this calf also received 2 liters 6 to 8 hours after that first feeding, and the calf was in quite extensive pain and agony, so much that it had to be euthanized and brought up to the diagnostic lab for further evaluation, because the veterinarian that was working with this calf and then the workers that were working with this calf too did their best to ease the pain of this calf. And this wasn't the only calf at this dairy. And this veterinarian was actually seeing similar situations at other dairies as well, where these calves, after the recommended colostrum feeding, had this distress or colic-like behavior. When the calf got here, and it got here within 2 hours of being euthanized, the body was still warm. We did a full necropsy here, and when I say we, it's board certified pathologists. We work with a group of 5 to 6 pathologists that are board certified, and they see a lot of dairy calves and see a lot of this kind of occurrence going on. That star at the top of the picture is actually the abomasum, the rudimentary forestomach of this calf. And the colostrum clot, this is actually like a cheese curd that was found in that space, measured 18 centimeters long and 28 centimeters long, and I believe it was 19 centimeters in height.
Size of a football.
Yeah, size of a football, as Dr. Sockett is mentioning here. So it was quite large. And it's going to take a long time for this calf to break down that colostrum curd. Now, it's important to understand that this doesn't happen. This consolidation of colostrum curd doesn't occur in every animal. Every animal is different, and it depends on the type of gastric juices or substances and the pH in that stomach to produce a curd like this. A lot of times we see smaller curds, as in this calf. This calf, again, was fed quite aggressively, colostrum feeding. We saw this calf, I believe that this calf was 2 days of age. This is still a lot of colostrum that we're seeing. It was fed 4 liters of colostrum within 2 hours of being born, and then again, 2 liters of colostrum 6 hours later, 8 hours later, and then 2 hours, 2 liters after that, um, 12 hours later. So a total of 8 liters of colostrum was found in this abomasum. And it was quite distended. There was air and gas there. Another thing that you might be able to tell, I don't know if you can see my cursor, but the lungs also show incidents of aspiration. So likely this calf was fed very large amounts of colostrum, and in the process may have aspirated some of that colostrum as well. But there was no indication by the person giving the colostrum that they had aspirated at that time. So they may have aspirated following a feeding that was not witnessed. So I think, or we believe, that aspiration pneumonia occurs more frequently than actually observed in these calves. And that's why we might be seeing higher incidence of respiratory disease in our calves. And again, these high volume feedings can contribute to colic-like behaviors. To say that we see this infrequently would be a misnomer. We see more evidence of large volume feedings in our calves in early ages than we care to see here at the diagnostic lab. And with that, I'll let Dr. Sockett take over, because this is his slide set now.
Well, thank you, Ryan. You did a good job in your introduction here. This calf here, it was consensus of the pathologists that aspiration occurred post-colostrum feeding. And basically, what we think happened is there's so much colostrum in the abomasum, and it got distended so much it couldn't handle it, and so it regurgitated up, and then it aspirated the colostrum. It was actually an aspiration pneumonia that killed the calf. So we don't know how often that happens. how often post-feeding aspiration of colostrum occurs. It does occur, but we don't have no idea what the frequency is.
Dr. Sockett,
So, yes.
there was a question in the chat about that case study or case report, and they were wondering what was the IgG and composition of the colostrum for the calf.
We didn't have, are you talking about this Guernsey here or the
No,
Holstein
this
before?
one I think they were talking
Okay.
about.
Basically, all we had information we had is it had a brick score of higher than equal or greater than 22% bricks. The calf was born at 2 a.m. in the morning. It was tube fed 10% of its body weight, which was 4 liters of colostrum within 30 minutes after birth. 6 hours later, it was tube fed first milking colostrum, fed 2 liters. And within an hour after the second feeding, the calf colicked and the calf was in severe distress and a lot of pain for up to 24 hours. And after 24 hours, we said, we've seen other cases like this. We got to euthanize this calf and find out what's going on here. And so it came up to our lab, there's this big curd. Since I started making veterinarians and people aware of this, I hear reports all the time of finding these curds sporadically in dairy operations. And in the past, they assumed that this was related to a tubing injury or something like that. But the calves are not being opened up and examining to try to determine what was initiating so much pain in these calves. And I might add, this calf was treated medically, and it did standard IV fluids, pour on Banamine. It didn't make any difference. So there is a downside to this 10% of body weight followed by 5% with the second feeding. And the reason it colicked after the second feeding is because the curd that was formed is a big proportion of it is still there at the time of the second feeding. So at the time, and when you do the second feeding, you expand the size of the curd that's already there. And so I put this in, and when I give the talk, I always simplistically say, if I offer a calf a bottle and nipple within an hour or two after birth, and it drinks 2.5, 3 quarts, 3 liters, 2.5, 3 liters, and it quits nursing, why does it quit? Everybody says because it's full. I said, that's right. Now I'm going to ask you the corollary question. If it's full at 2.5 to 3 liters, and we know in studies in humans that if you continue to fill the abomasum or in humans the stomach, you initiate pain. And the more you overfill, the more pain you cause. And the more pain you cause, the more inflammation there is in the wall of the abomasum, which can lead to long-term problems in these calves, including lack of abomasal function issues and ulceration. So if that calf can comfortably drink 2.5 to 3 liters of colostrum, please explain to me why it's okay to tube at 4 liters. Because I don't understand why it's okay. Okay, so that's leading on to why the title of this talk today is, okay, the game is changing. We want to feed smaller volumes of these calves, and this is what we're going to lead into. Okay, okay. There's just now impressed in the Journal of Dairy Science, an extremely well written manuscript. Some of the authors that are probably on this webinar. It's one of the best studies I've ever read. I found it fascinating, and I keep reading it over and over again. Every time I read it, I discover a little tidbit I didn't notice. But basically, what they did, because of these concerns, are we feeding too large a volume of colostrum? They took 88 calves, 22 calves per group, got either 8, 10, or 12% of their body weight. Now that's an approximate thing because they didn't weigh the colostrum. So it's approximately 6, 8, 10, and 12. We don't know for sure because they didn't weigh the colostrum and adjust the volume accordingly before the colostrum was fed. And we know there's quite a variation in the weight of colostrum depending on the quality and other factors. So there's a variation in colostrum quality from an IgG perspective. There's a lot of other things that affect the weight of the colostrum. But to be fair to the authors, it's a logistical nightmare to try to figure out how to get this all coordinated together. So I understand why they did what they did because it's not easy. In fact, it's very hard. So they were fed approximately 6, 8, 10, 12% of their birth weight. They received a single feeding that was delivered by an esophageal tube feeder. Blood was collected for transfer past immunity assessment 24 plus or 2 hours after the feeding. The There's a way that mathematically you can estimate based on what the amount of hemoglobin that's fed to the calf or IgG and what the serum levels of IgG are. You can calculate, and if you know the way of the calf, you can calculate approximately what proportion of that colostrum was absorbed. We call that a parent efficiency absorption. So if you fed 100 grams of IgG to the calf and you estimate there's 50 grams in the serum or the plasma of the calf, that means efficiency absorption is 50%. Okay. And abomasal emptying was studied, and I'll get into that in a little bit. But what I found was the interesting concept is as the volume goes up, more and more of the meal is retained in the abomasum for a longer period of time. So at 6% of body weight at 8 hours post feeding, approximately 50% of the meal was still there, and at 12%, we went up to about 65%. Well, that's when you think about it, there is no colostrum absorption occurring in the abomasum, none. So you want that hemoglobin to get out of that abomasum as quickly as possible to get to the absorption sites in the small intestine, because that's where absorption occurs, and with time, the efficiency absorption goes down. So you really don't want to feed something that hangs around the abomasum for long periods of time, plus the risk of colic. They did what they call ethogram analysis, which they basically put video cameras on the calves and observed them for the first 2 hours after the colostrum was fed, and they had a software program which is developed for behavioral sciences to see if there's evidence of these calves experiencing see these calves had if you're feeling any pain-related symptoms after the feeding. So this is the first slide here, and I want to show you the first slide on the left. Okay, so basically, here's the vocalization. It was not statistically significant, but you can see as the volume goes up, they tend to vocalize more. But this is on the right-hand side. This is the interesting part. They looked at for 2 hours how many whether they kicked at their abdomen or not with their hind legs when they're laying down, and they observed none of that behavior at calves fed 6 and 8% of their body weight. And more studies need to be done so we don't over-interpret this, but they started seeing it at approximately 10% of body weight, maybe a little less than 10%. They found that in 27% of the calves, and then at 12% of body weight, they found it in a little over 40% of the calves. So then you think to yourself, so the old colostrum feeding recommendations, if this data is confirmed in the future, is confirmed to be very repeatable, that means roughly a third of our calves are experiencing signs of pain. And it's bad enough that it's pain, but what's going on in the abomasum? It's overdistension, inflammation, can have long-term effects and short-term and long-term effects on the health of the abomasum. So what this data is telling us is ideally you want to feed less than 10% of the body weight of the calf, okay, with the first colostrum feeding. So this is the parent efficiency absorption based on 6, 8, 10, and 12% of body weight. So since these two have the same letter A, that means there is no statistical difference in the efficiency absorption between 6 and 8% of body weight when fed colostrum. But 6 and 8%, it was a difference between 10% and 12%, and there was a difference in efficiency absorption between 10% and 12%. Okay, and then this shows a lot of variation in the apparent efficiency absorption. Some of that will be calf-specific factors, but some of it was that the calves were fed back. Each group of 4 calves was fed the same volume of the same colostrum. That means there's 22 different colostrum different samples of colostrum or volumes of different colostrum with different properties and different qualities fed to these calves. So some of this variation that we're seeing just can be explained just by the differences in the quality of the colostrum that was fed to the calves. So I jokingly put this here, and here's 6%, 8%, 10%, 12%, and you look at parent efficiency absorption versus percent body weight of the calf. You can see as the body once you get past 8% here, as the volume fed as a percentage of body weight goes up, the efficiency of absorption goes down. And some of it's going to be related to the fact that it's taken longer for the colostrum to exit the abomasum and get to the absorption sites in the small intestine. So that's really important to know. So you're feeding a bigger mass of immunoglobulin when you feed these larger body weights. But if your efficiency of absorption is going down and you have these health complications of the calves, is that really the best thing for the calf when you think about it? We believe no, but consensus has not evolved around this at this time. So there's a consensus of people in the field can say with confidence exactly what the right thing to do is. We have our opinions, and other groups have their opinions, but what I find is the research is coming towards the position that Dr. Breuer and we've had now for 3 to 5 years. So let's just put the brakes on this for a minute and think. Now, okay, you're telling me I should feed a smaller volume of colostrum to my calves, but I got to get a sufficient mass or amount of immunoglobulin or IgG given these calves, so I have successful transfer of passive immunity. And I want more calves in the excellent category because of respiratory disease, and I want more calves in the good category, good and excellent category for the reduction in calf scours. How do you do that? How do you do that? You can implement it on a farm. Well, obviously, the components, it starts with the dry cow, as we know, and that this is well described of all the things that are important in a dry cow to assume to maximize the probability of getting good quality colostrum. You need well-trained staff with written protocols. But this is concepts that it's really important that you understand this. Since we're feeding a smaller volume, we must maximize the efficiency of absorption as much as we can. If colostrum is really liquid gold, let's treat it like liquid gold. So we want to maximize the proportion of the immunoglobulin, which is just a marker for the quality of colostrum that we can measure. There's a lot of other bioactive substances and stuff in there that are important as important or equally important as well. So we got this is a nice study that came out of Quebec in 2021, and they looked at different management factors that had a positive relationship with apparent efficiency absorption, with the serum immunoglobulin or IgG levels that were in the calf. The number one factor was the concentration. The odds ratio is 2.9. That's telling you that if you feed really high quality colostrum, like that 100 grams per liter or higher, versus 50 grams per liter, those calves are 2.9 times more likely to have excellent to good transfer of passive immunity than the calves are getting the 50 grams per liter. Okay? So the concentration and the mass of IgG fed, there is a minimum mass you must feed based on the body weight of the calf. That was the next most important thing. The interesting thing, the third most important variable was timing. So think about our recommendations: timing, 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 timing. We haven't even been talking about the two most important variables that affect efficiency of colostrum absorption. We have to start thinking about the quality of the colostrum and the mass of immunoglobulin that was delivered. And by the way, colostrum cleanliness had no effect in this study on apparent efficiency absorption. And so cleanliness is not all bacteria are the same in colostrum. So some types of bacterial affect absorption more than other types. So it's not surprising to us that colostrum cleanliness did not have any impact on efficiency absorption. But for calf health and everything, it's important that we do have clean colostrum. Don't get me wrong. So if I'm going to a dairy operation and I'm asked to develop a colostrum feeding program. How do you do it? Well, the answer is I can't do it until I get some basic information of what's going on in the herd. Because if you're going to go to the next level, it has to be a database. You got to know the database decisions so you can make informed decision what's the best way to go or the best compromise to achieve our end goals. So ahead of time, we need to start collecting some data. What is the birth weight of these calves at birth? What is the average weight? What is a 95% prediction interval around the median to tell me what the weight of the smallest calves is? And what is it? Tell me what the weight of the largest calves are, right? Are we feeding pooled colostrum or individual colostrum to the calves? You need some baseline data to get an idea of what the weight of the colostrum is. Okay? What is it the normal weight per liter or per gallon of the colostrum? Typically, colostrum on a gallon base rate ranges from 8.5 to 9.4 pounds based on limited studies us and others have done. You need to know the weight of your colostrum in your herd because we're talking about a percentage of the body weight of the calf. So you can't develop a program until you know something about the weight of your colostrum that's in your operation. Okay, you have to be able to evaluate colostrum quality. And the best way to do that is what is your percentage brick scores? What is your mean? What is your standard deviation? What is the normal range from high to low that's observed in that operation? You need to know some information about timing because in some operations where they can't get the colostrum in as soon as 2 hours after birth, some of these calves are 6, 8 hours when they get in them. That's a totally different program than if they're getting it in real quickly within a couple of hours after birth. Because if they're getting it in 6 or 8 hours, you got to feed a highly concentrated, small volume, get that out of that colostrum out of that amalgamation as fast as possible to the absorption site. You have to, that's the only way to do it. And then once you get all that data together and you got all this thing, then you can start making some volume decisions, okay? And then what are your goals? What do you want to achieve for transfer of passive immunity? What percentage of your calves do you want to have in the good and excellent category? Let's say you got, like this herd earlier, you have basically 40% of your calves in the excellent category. How do I get it to 65%? Or let's say 50% to start. How do I get it up to 80%? These are all these things you have to think about. So you have to establish goals. And at the end of the day, is it practical and will you get buy-in by your employees? But you get to get buy-in, they have to understand the concepts and why we're doing this. But I can't set up a program until I have some basic information of what's going on in the herd. So this is the example of a herd that did an exceptional job. And I was part of a small study. The samples were kindly provided to me by Land O'Lakes Purina from their farm in Gray Summit, Missouri. So just to go through it, these were Holstein calves. Their average birth weight was 43 kilograms, with a weight distribution of 37.7 kilograms to 51.3 kilograms, or 72 to 113 pounds. If you're going to feed a single fixed volume, you got to know what's going on here. Okay. Colostrum weight, the average weight, what we came up was 8.8 pounds per gallon at 40 degrees C. Now, this is really, really important. You must weigh that colostrum at body temperature of the cow or slightly warmer, because because as colostrum is mostly water. As water warms up, it expands, which means the weight per liter is going to go down. For example, at 4 degrees Celsius, which is refrigerator temperature, one liter of water weighs 1,000 grams. But as you warm it up towards 40 degrees Celsius, the water expands. The weight drops from 1,000 grams to 922.2 grams. So you must weigh your colostrum at the temperature it's being fed to the calves. This is the first feeding colostrum quality. The mean or median Brix was 29.8 for the first feeding, and this is the Brix range we saw. And this is the Brix score for the second feeding was 27.2, and this is the range that we saw. So what they did is 2.8 liters of colostrum was delivered by an esophageal tube feeder within 2 to 3 hours after birth. And then 8 to 12 hours later, they were offered a second feeding of 1.9 liters, which is 2 quarts. Okay. What was really interesting is 11 to 24 calves did not nurse at all their second feeding. Okay. And when you look at it, there's no surprise here. The smaller calves, fixed volume, the smaller calves are more likely not to drink the second meal than the larger calves. So basically, if the calves weigh 90 pounds or less, they're less likely to drink the second meal. And if they're 99 pounds or larger, they're likely to drink it. So there's all these moving parts here. So another part of the conversation you have to have is, okay, if I know a certain percentage of the calves will not drink the second feeding, should I not provide a second feeding, or should I tube feed a smaller volume in the second feeding? That's a conversation you have to have on site with all the interested parties and come up with a consensus of what you want to do. So in this study, the smallest calves, this basically the 75-pound calves, received 8.9% of their body weight as colostrum. I know that because I had the weight of the calves at birth and I had the weight of the colostrum. Okay. The average size calves, the ones who are right at the average with a median, they were fed 7.2% of their body weight with first milking colostrum, the first feeding. And the largest calves were fed 6.1% of their body weight. All this talk about percentage of body weight, you have to think about, well, that's overly simplistic because these calves all weigh different, right? So if you design your program to the mean, you're going to feed too much to the smaller calves. So the calves that only drank one feeding, okay, their mean serum IgG was 37.2 grams per liter, and excellent category is 25 grams per liter or higher. They consumed approximately, I knew the IgG concentration of every sample. I knew the weight of the colostrum. I knew the volume fed. So we could calculate what was the total mass of immunoglobulin fed to these calves. So the one feeding calves got 344 grams on average. The two second feeding calves got 533 grams. Okay, so but look at it about 12 hours after birth when it was fed. Look at how much higher this is than the calves that got one feeding. So the calves that had the second feeding that was offered to them by bottle and nipple, their serum IgGs were a third higher. Okay, so when you go through the classification system, how did it sort out? Like I'm talking about excellent, good, fair, and poor. 22 calves. Okay, it should be 22 calves. Two calves had good transfer of passive immunity. 22 were excellent, right? So we had 91.7% of the calves had excellent transfer of passive immunity. So you can really accomplish a lot if you don't feed too large a volume of colostrum and you start out with some really high quality colostrum. It's amazing what you can accomplish with these calves. So the next slide, I looked at the correlation between grams of IgG fed per kilogram of body weight, or you can think about it, and you can multiply it by 2.2 and think about it in pounds, and serum IgG. So our correlation was 75% of the serum IgG levels in these calves could be predicted by simply the mass of immunoglobulin fed under the conditions of this study. So this is to show you the trap that a lot of people fall into. The more grams of hemoglobin you feed, the higher the serum IgG. So you can see if you only paid attention to massive hemoglobin fed in serum IgG, you can fall in the trap where you want to feed these large volumes. You have to remember you're dealing with a biological entity. You're dealing with an animal as inflammation has a fixed capacity to expand. So the sweet spot, if you really think about it, you want to really blow the doors off. You want to get around 10 grams of IgG fed to that calf in two feedings, 10 grams per kilogram of body weight. Okay, or if you want to say about 4.5 to 5 grams per pound of body weight. Okay, this calf up here is amazing. Okay, the benchmark is 25 grams per liter or higher. This calf's serum IgG was 82.3 grams per liter. It's amazing if they get two feedings into them of high quality colostrum, how much these calves will absorb. The total mass of IgG that we estimate this calf was fed, then the calf weighed around 92.5 pounds. It was fed 704 grams of IgG. So it's amazing what you can accomplish if you have really good colostrum to start with. So what have we learned from this? You cannot establish a science-based modern colostrum feeding program without basic data. What is the weight of the calves? What is the weight distribution? What is the quality distribution? What is the weight of the colostrum? What's the timing information? All this stuff. You must measure colostrum quality. You can't do it without it. You want to feed 10%, you want to feed less than 10% of the calf birth weight for the first feeding. Okay? If the same volume is fed to all the calves, the smallest birth weight calves will determine the maximum volume you can feed. The largest calves will determine the minimum mass of hemoglobin needed, or IgG, for successful transfer of passive immunity. A science-based fortification program that delivers the correct mass of IgG without causing the osmolality to become too high is needed for those where the quality is not high enough to achieve your goals of feeding the small volume and getting the correct mass of hemoglobin to the calves. But you just can't willy-nilly buy any colostrum replacement product. You have to it has to be investigated, and you have to know the grams IgG delivered, and you have to know how it affects the osmolality of the calf. And I can tell you, after looking at different products in the marketplace, that there's tremendous variation in the osmolality that's fed in the colostrum when you feed the same mass of IgG to the calves. So you don't want, ideally you want to be never higher than 600 and ideally less than 500 milliosmoles per kilogram of body weight. But I had the same colostrum fortified with 4 or 5 different products, all mixed it up with ensure that they had the correct grams of hemoglobin in that colostrum, and my osmolality ranged from 500 to 800 milliosmoles. You can't just willy-nilly start going out there. You have to work with something that's been validated that you know will work.
You want to talk about measuring colostrum quality and pasteurization, that it likely will go down after pasteurization? Well, you'll
Yeah.
have some changes, but it's important to view the Brix change or Brix before pasteurization and after pasteurization.
And the question is does it matter if you do your brick screen before or after pasteurization? And that's a really good question, Ryan. So it doesn't matter for the bricks, but if you got a pasteurizer that's running too hot and you get denaturization of your hemoglobin, you can't detect it with a bricks. The only way we know to detect it is you have to actually take a colostrum sample where it's sent to a laboratory and they actually measure how much IgG is in there.
That's what I was meaning.
Yeah, and it's really interesting the thermodynamics of pasteurization or of colostrum. Colostrum, because there's such differences in viscosity between different batches of colostrum, the thermokinetics are all different depending on what the viscosity is, and that may affect the hemoglobin concentration. So, do you want to feed a second colostrum feeding protocol? Yes or no? the second colostrum feeding should be smaller must be smaller than the volume than the first feeding. Ideally, if you're going to do a second feeding, you want to do it no sooner than 8 to 10 hours after the first feeding. That's if you allow them to nurse out of a bottle and nipple. If using an esophageal tube feeder to deliver the second feeding, it must be a smaller volume than the first feeding. I cannot say that strongly enough. And you should give it no sooner than 10 hours after the first feeding. And what we learned from the study is calves can absorb a surprising amount of hemoglobin with the second colostrum feeding when it's given somewhere around 12 to 14 hours after the 12 to 14 hours after birth. And that's all we have for today. I know it's a lot to go through and thought provoking, but we got to develop site-specific colostrum feeding programs based on the demographics of what's going on in the operation. No more of this generic stuff that doesn't work.
Are there
All right.
questions, Jen?
Yeah, thanks, Dr. Breuer and Dr. Sockett, for your presentation. I think it really gets my wheels turning as far as colostrum management and how we implement this onto farms. And so I'm just curious, when you work with producers, how I guess well is this implemented with employees? Like, is it a steeper learning curve to understand this concept than maybe our traditional thought process?
Well, what you do is you go out and you have a meeting and you talk about uh, the potential complications associated with the current colostrum feeding guidelines, which, by the way, are over almost 25 years old. I don't drive the same car I did 25 years ago. Cars are a lot more technology in today than it was 25 years ago. So, are they interested in doing it? You have a meeting, you talk about the pros and the cons. Some people really like the simplicity. And then the other conversation is, do you want to you want to have feed three different volumes for small, medium, and large size calves, or you want to feed them all the same volume? You get all that information, and then you sit down and you say, okay, this is the data I need before I can design something for you. And once we design a program we think will work, we sit down and we say, okay, based on what your input was, this is what we think will be the closest to you want to achieve your goals. Is this doable? Or is there something you want to tweak here? If you want to tweak something here, tell me what it is, and we'll talk about whether that'll affect the probability of a successful outcome or not. So it's really a team-based approach to the problem with everybody involved in feeding that calf, caring for that calf early in life.
And one other thing too, Jen, because you bring up a good point about the ability for people working in the maternity pen or in the calf area, because I do a lot of outreach programs as well, is having often these meetings with management and the people that are working with the calves, because sometimes there is a disconnect on this, and maybe the people that are actually feeding the calves are seeing a higher level of this discomfort or colic-like behavior, and potentially having this change in protocols and looking at these protocols a little bit more minutely will change things, but it might be overlooked or might not be sensed if you're not having this good conversation on a weekly or monthly basis.
Because I think to follow it up is once it gets accepted that feeding 10 to 12% of their body weight is unacceptable, then the next question is, well, how do I implement feeding a smaller volume and still meet my goals of transfer of passive immunity? That's the crux of the problem. But before you can get too far, they have to understand the limitations and the problems created by large volume colostrum feeding. And another thing is, we're wasting about a third of our colostrum in these good colostrum herds with these silly recommendations of 10 and 12% of body weight. That's stupid. That really is stupid. So that's why you need to know the information about what the quality of the colostrum is in that operation, if there's any, and monitor it if there's any seasonal variation. And if it changes the quality, then you have to tweak your program.
Yep. Yeah, if anybody has any questions, you can certainly either unmute or type them in the chat box there. I also did put the evaluation link into the chat. So before you log off here today, if you wouldn't mind clicking on that and completing that, that just helps us with evaluating our webinar programs here and providing insight on upcoming topics as well. So Fred, are you seeing any questions come your way?
Nope, I'm not seeing any questions.
Okay. I did have one other question. So when you took those respiratory scores and those calves that were higher than a 3, how often were they ultrasounded? Was it a weekly thing through pre-weaning or was it an average?
That's ultrasound data that was done on the calves just before they started the weaning process.
Okay, so it was
Most
an
most
at
so most of those calves were every in that operation. I can't tell you exactly. I think those calves were around 6 to 7 weeks old when the ultrasound was
okay,
done.
But
okay,
I believe that practice works with dairies around here. If they don't do it on a weekly basis, specifically for calves with respiratory disease, they'll monitor and screen those calves. And like Dr. Sockett says, when they're weaning them, they'll get an ultrasound. They don't do it on a weekly basis. They'll do it every week or every other week.
okay. I was just curious if that data was a specific time frame, so that's good. And then I think, oh, my other question that I wrote down was, do you think there's any other calving or stress issues that are going on during the birthing process that would cause the calf to have it affect the curdling process? I'm just thinking of like dystocia or, heat stress in the dam, cold stress, those types of things. Is there higher
Yeah.
incidence of curdling because of other issues going on?
That's a really good question, and it hasn't been studied that well, but I can tell you this. In normal healthy calves with unassisted delivery they have good vigor scores and all that kind of stuff, is not every calf will form a curd. The best estimates around that I've read where it's been looked at is around 50, no more than 60% will even develop some curds. The ones that form the well organized curd that we showed in this publication and in this talk, that's less than 5% of the calves. But the problem is when you're out there feeding them, you don't know which one's going to form a curd like that. So
Right.
you have to assume they're all at risk of developing a curd like that,
Okay.
right?
Hmm.
I could tell you the reasons and the variation and stuff, but that's just the
Yeah.
way it is.
Yep.
But you do
That's good.
ask a good question, Jen, because there is concern or thought processes going on that dystocia does complicate things in calves, especially when they're at a higher risk of hypoxia. So that's lack of oxygen to the tissue. And when we have lack of oxygen to tissue, then we have poor tissue transport of materials through the GI tract and even other tissues of the body. So dystocia animals, like Dr. Sockett said, they're difficult because there's not a lot of studies out there looking at them, and they are in a class of their own because there's a lot more variables with them.
And another thing is in the study that was exceptional study, those calves that fed 10 or 12 approximately, because they didn't weigh the colostrum, and I understand why, because it's really complicated to do that. Um, Some of those calves at 10 and 12%, albeit a small percentage, regurgitated colostrum during the colostrum feeding process. And we have this discussion internally here on an ongoing basis. How much, if they regurgitate, how many of those are actually getting aspiration pneumonia, and how many of them are actually going on to develop subclinical pneumonia, like they're detecting by ultrasound in these calves? We don't know the answer to that question. That's a very black box that needs to be looked at. All I can tell you is the larger the volume, if they didn't see any regurgitation, the calves were fed 6 and 8% of their body weight. So another complicating factor because of the colic is your calves are at increased risk of regurgitating colostrum as well.
All right. Thanks. I'm not seeing any more questions in the chat. So again, I appreciate both of your insights on this topic, and really kind of exciting as we enter in a new stage of colostrum management in the next couple of years with research. So I appreciate you providing this and giving us a lot to think about and get our wheels turning about how we manage our calves.
Yeah, like you said, Jen, it's definitely an area that is going to be exciting in the next few years.
Yep. So I want to thank everybody for being on here today, and hopefully you can join us next Wednesday at the same time, and I'll send out a reminder link ahead so you can log on, but otherwise we hope you have a good day. Thanks.
Take care.